and then we'll be good to go. Hey everyone, welcome back. This is Ari, and I'm here with Dr. Evan Hirsch, who is a fatigue specialist. And Evan, how are you today?
I'm good, Ari. Thanks for having me on.
Cool. So to give all of you a little background about why I'm bringing Evan here, it's mainly because my approach has certain limitations. And I address things from the lifestyle perspective, but when you're dealing with this kind of program that you're all in right now, where I have this program that's addressing all these different layers of lifestyle factors that can potentially affect your energy levels, one of the issues is it's not bio-individualized, and I don't have diagnostic methods integrated into this where we can actually assess, do you have some of the things that we're going to talk about in this interview, like chronic infections or biotoxin issues or heavy metal toxicities or things like that. And Dr. Hirsch is a specialist in those areas, and he knows a heck of a lot more than I do about all that stuff. So I wanted to bring him here and talk about his expertise. So Dr. Hirsch, can you just tell us a little bit about your background, what you do, and how you got into it?
Sure. Yeah, so I ask a lot of questions. And so when I was growing up, I was really interested in science, and I just had this passion for helping people. And so I grew up in New Jersey, and so there's no naturopaths, really no chiropractors when I was growing up. And so it was kind of like a good fit for me to plan to go to medical school. And so I went to undergrad, went to medical school. And when I got into medical school, once again, I had a lot of questions. I always want to understand things. I don't want to memorize things. And so professors that I had, they were great, but they just didn't really answer my questions to the fullest degree. So I had to start doing research and had to start asking more questions and thinking about the power of the mind, the power of the body, what's going on really at the most basic level. And so I went, and the first training that I did was a clinical hypnotherapy training when I was a second-year medical student. And then I met some holistic medical doctors, and they said, hey, you should come join our group. So I went to American Holistic Medical Association meetings, and that was just amazing. They were talking all about, how magnesium can reverse migraines and like all this nutritional therapy stuff, which was just wonderful.
And this was already while you were in medical school?
Right.
Oh, wow. So you're getting an early start. Just to point this out to people, he was in school to become an MD. And he's at the same time doing all of this holistic stuff. That's very, very unusual.
It is, yeah. And I thought I was really the only person of my kind. And then my fourth year, we were able to do electives, and I found this elective at Bastyr, which they called CAM camp, so Complementary Alternative Medicine camp. And it was a month-long rotation for allopathic and osteopathic students with their faculty. So we went to, and we stayed at Bastyr, which was just a wonderful experience, and got a chance to know a lot of naturopaths. And we learned all about nutrition and homeopathy and herbs, and it just kind of blew my doors off. And then I met for the first time other medical students who were like me.
Cool.
And that was just, it's just amazing when you find your community of people who you jive with.
Mm-hmm. Yeah, for sure. And so how is that? So you graduated medical school, and then you went on to go do your residency. And what did you do your residency in?
Mm-hmm. So I was all set to do a psychiatry residency. Mm-hmm. And then I decided to change my mind, and I decided to take a year off between medical school and residency. And I went and I got my yoga teacher training at Kripalu in Western Massachusetts.
Cool.
And I went and I did a medical acupuncture training for physicians through UCLA, the Helms program. Mm-hmm. And I did some travel, went to Australia and Alaska and all that sort of stuff while I was doing other rotations too. So,
nice.
But, just once again, just asking these questions, what does health look like, from a number of different paradigms? How can I support people? And so at this point, I was really thinking mostly about integrative medicine and holistic medicine. So kind of this idea of, you have high blood pressure. I'm going to use acupuncture, yoga, and magnesium instead of a conventional medication. Mm-hmm. And then I went into residency, and in Olympia, Washington, and my residency was great. As soon as I proved myself in allopathic medicine, I decided to go into family medicine. I changed my mind.
Mm-hmm.
I decided to go into family medicine because I wanted to really address the whole person.
Yeah.
And so I did the family practice program here in Olympia. It's a University of Washington program. They've got a division in Olympia. And the people were really great. Once I proved myself in allopathic medicine, they really allowed me to do more integrative medicine. They just said, well, why did you do this, when they were reviewing my charts? And I would send them the data, the research. Cool. And they would say, okay, that looks good. And they even allowed me to do acupuncture. So I was doing acupuncture on medical exam tables. So it wasn't super comfortable for my patients, but it was kind of, whether it was covered or not, we were in a low-income clinic. And so some of these people who wouldn't have access to this stuff was able to get access. So
that's awesome. So you were was this during your residency that you were able to do some of this stuff?
Yeah, mainly my third year.
Wow, that's awesome. So you kind of played their game. They were skeptical of some of the alternative stuff, and you said, all right, well, I'm actually going to show you the scientific literature that says that this stuff works, and you're going to have to accept, that since there's science on it, that this is okay.
Right.
That's awesome.
Yeah, they couldn't really argue with it when I showed them the data.
Cool.
Yeah.
So how did so take me on the journey, the next step. So how did you end up from there as a fatigue specialist?
Mm-hmm. So let's see, around this time, well, actually around 2004, when I entered residency, I met my wife. She was vibrant, full of joy, very social. And then right after we got together, she ended up starting to feel ill. And she ended up getting fatigue for about 3 years.
Wow.
And I was totally powerless. I was studying with Jonathan Wright and doing this stuff in residency, and I couldn't help her. She'd done a bunch of research on her own, asked a naturopath locally for an adrenal saliva index, and her adrenal glands were totally bottomed out. And I was with her through all of those challenges, and it just left. It was just really hard. And so then I came out of residency, and the first training that I did out of residency was in functional medicine, the Institute of Functional Medicine, and that was really great. I had heard about it for a couple years previously, when I went for my board certification in holistic medicine and a couple of other trainings, and I came out and I found functional medicine, and it totally jived with me. It was all about getting at the cause, which I tell people I practice causology medicine. What is the root cause, or root cause medicine? That's the most important thing to me. Let's get down to the roots and let's figure out what's causing this, because then you can remove that cause and then people can get better. So I came out of residency, did this training, started my practice, and very soon thereafter, I got fatigue.
Oh, wow.
Yeah. And then I had fatigue for about 5 years while I was treating my patients. And, functional medicine is just amazing for lending itself to treating fatigue. So the people that were coming in, I just started seeing a lot of fatigue. And so as I was learning more by practicing on patients, by practicing on myself, I was putting together basically all of the best practices that I found of these different experts.
Cool.
What I now call my Fixer Fatigue program.
Cool.
But it took me about a decade to really get rid of my own fatigue. I've helped about 1,000 people in my own practice resolve their chronic fatigue. And so now I'm I have the energy, I have, more patients than I know what to do with, and I really want to help all of them, but I can't because I'm limited by time in a one-on-one session. And so I want to help, my goal now is to help 100,000 people resolve their chronic fatigue.
Awesome. I love that. Very cool. So let's get right into it. So in your practice, how long have you been in practice, by the way?
Almost a decade, 9 years.
Awesome. So in those 9 or 10 years that you've been in practice, what have been the biggest factors that are causing people's fatigue, lack of energy? And maybe you can talk a little bit too about the difference between your approach versus the typical allopathic conventional MD approach.
Sure. So there are things that we come into contact with in this world that aren't supposed to be in our bodies. So those are heavy metals. That's lead and mercury and arsenic and cadmium and stuff like that. Chemicals, there's 84,000 chemicals that we're exposed to that are dumped into the system every year in a lot of our products and whatnot, and only 10% of those have been tested.
Wow.
Molds. So mold is a huge problem. About 50% of all buildings in this country have water damage, and we don't know which 50% those are.
Yeah.
And mold is a known neurotoxin and causes a number of problems. And then infections. So Epstein-Barr, Lyme, Mycoplasma, Yersinia. So there's a number of these different infections. So those are all the things that can cause fatigue from kind of like an exogenous or like an outside source.
Mm-hmm.
And what ends up happening is that causes deficiencies on the inside. So the stress of all of those things will cause hormone deficiencies. So your adrenals will be taxed, which is a little triangular gland that sits on top of the kidneys that's responsible for producing your get up and go and manages insulin. I mean, you talk a lot about this in your class, which is really awesome. Mm-hmm. Sex hormones, thyroid hormones. So the stress of this, as well as all of those things that I call the usual suspects, which are heavy metals, chemicals, molds, and infections, all of those usual suspects will also cause autoimmunity. So they'll get hidden in the thyroid. The immune system will try to get rid of it and has to go through the thyroid to get there. And it starts damaging the thyroid and causing autoimmune thyroid disease.
And then once you start damaging the thyroid gland, now you have hypothyroidism and a whole set of new problems that result from the hormonal issues of that whole set of problems.
Absolutely. There's a beautiful dance of the hormones where the thyroid, the adrenals, and the testicles in men, ovaries in women, all have to be in concert. Mm-hmm. It's like a beautiful symphony. And if somebody steps out of that dance, it leaves the other two holding the bag. And so oftentimes when somebody comes in and they're like, I know I've got adrenal problems, and we look, and sure enough, they've got adrenal problems, but they also have thyroid. And oftentimes you can improve the thyroid function by boosting the adrenals and vice versa.
Okay. So the usual suspects are metals, hidden infections, chronic infections, and biotoxin, mainly mold. Is that correct? Did I miss one, or are those
chemicals?
Chemicals, that's right.
But yeah, and biotoxins, I would put heavy metals, chemicals, and mold, and actually all of them are biotoxin illness.
Okay.
We have some markers that will detect them generically, and then some that are more specific at determining which is the cause. And usually people have multiple causes. It's the number of hits that it takes that people get throughout time, the number of stressors. So whether it's being exposed to mercury. So I got exposed to mercury by having mercury fillings and by eating a whole bunch of tuna fish growing up. I ate it like every other day, probably for most of my childhood. And we didn't know, that tuna had all that mercury back then.
Right.
So, or chemicals, all the chemicals that we're exposed to. So it's all these hits that we get, plus emotional and mental hits. So, for me, it was going through residency, going through medical school, emotionals, like a breakup, or and then of course there's car accidents, so anything that's stressful, they will end up causing dysfunction in your hormones, dysfunction in the immune system, and then the infections can take hold. So it's kind of this, I call it the imperfect storm, where there's all of these things acting at the same time, and all of them are kind of feeding off of each other, and they result in the chronic fatigue picture.
Gotcha. So how can someone know if they have some of these problems? Is there a certain set of symptoms that might hint at, this is coming from a chronic infection or coming from heavy metals? Are there certain tests, like blood tests or stool tests, that people can start to go to start identifying this? So now that, I guess, let me summarize my question as, now that we know that these factors can impact our fatigue, our energy levels, how do we start going about identifying if these are factors for us, and figuring out which ones are, maybe which ones aren't?
Absolutely. So we have a 17-page initial questionnaire. So there are a lot of questions to ask around this. And the symptoms that you're looking at can be congruent or can be similar depending on the cause. So if somebody's got heavy metals, if they've got mercury toxicity, they could have brain fog, fatigue, and neuropathies. But they could also have that if they have Lyme, or if they have Epstein-Barr, or if they have mold. So there are some which are a little bit more specific. Like, for example, if you have pain or discomfort on the bottom of your feet and you have occasional headaches, weird stretch marks, some vascular diseases, you probably have Bartonella, which is a co-infection of Lyme. So there are some of these that are more specific.
Right.
Another example is babesia, where people will have like shortness of breath. They'll have depression and anxiety so bad that it even could lead to suicidal thoughts.
Wow.
And sweating, like if you're sweating all the time, you don't know why you're sweating. That's caused by babesia. So some of those are a little bit more specific, but generally the people who have chronic fatigue syndrome, which is basically 6 months of 4 of these symptoms of like enlarged lymph nodes, muscle pain, fatigue, brain fog, that's a bit of an oversimplification, and you're not, a lot of these diagnoses are kind of a conglomeration of symptoms.
Right.
And they're not differentiating, and they're not getting at the cause. One thing I found was that I had to go for the broadest differential I possibly could if I was going to catch everybody who came into my practice. So I needed to say, okay, so fatigue can be caused by 5 things, that's great. But if I find out a 6th thing or a 7th thing or 20 things, I need to make sure that I'm addressing all 20 of these things when somebody walks in, to make sure that I get at their fatigue. Because if I'm addressing 19 things and the 20th thing is the major thing, I'm going to miss it.
Yeah. Yeah. And I totally agree with that. And my program is designed around that as well. For some people, circadian rhythm and sleep may not be a huge factor. For other people, it is a huge factor, but everybody's going to benefit at least a small amount, if not a huge amount, from addressing those habits around circadian rhythm and sleep, just as one example. And I think you're really saying the same thing. It's like we have all these potential causes. The symptoms are, kind of diffuse and not always easy to say this symptom is a direct result of only this one factor. And so you want to address as many of the factors as possible. Is that where you're going?
Absolutely.
Cool.
And the great way of thinking about this is that when a patient comes into my office, they have like 16 nails in their foot.
Mm-hmm.
And so I can take out the gluten nail and they can go off gluten, and they may experience, a 1% increase or nothing, because maybe it's the mold nail that has to come out. But once I remove that mold nail, then all of a sudden that gluten nail becomes that much more important. We got to remove all the nails.
Mm-hmm.
We got to make sure their sleep is good. I mean, that's number one, but
Mm-hmm.
you know all about that. Make sure their circadian rhythm is good. We got to remove all of those nails, in order for them to really achieve the best health of their lives.
Cool. Yeah. And by the way, that's really why I brought you here, is because I realized that there was some nails that I was missing as around specifically hidden infections, metals, and biotoxins, and addressing some of these other environmental chemicals. So, you're taking care of some of these other nails here. So, are there any specific symptoms that will suggest to somebody, obviously fatigue in general is a very diffuse symptom. It's a very, it can be caused by so many dozens of different factors that fatigue by itself doesn't really tell us a whole lot about the causes. It's sort of like a fever. If you have a fever, it could be caused by a million different things. Some are very simple, like common cold. Others might be life-threatening. So are there maybe like a handful of symptoms? I know you mentioned swollen lymph nodes. Is there any other specific symptoms that might suggest a hidden infection as opposed to, let's say, metal toxicity or chemicals, for example?
Or
is it still too vague?
Yeah, unfortunately, it's too vague. And so usually everything has to, unless something is screaming, if somebody's got Lyme disease, they're going to have migratory arthralgia. So they're basically going to have joint pain that migrates around the body, where one day they wake up and this joint hurts, next day they wake up, the other joint hurts. And you can't really have anything else except for Lyme with those symptoms.
Gotcha.
Epstein-Barr is going to give you enlarged lymph nodes. It's going to give you mood issues, so depression, anxiety. It's going to give you the fatigue and the brain fog. But the enlarged lymph nodes oftentimes is Epstein-Barr, though it can also be Bartonella, which is otherwise known as cat scratch. So if you have a cat scratch in a certain area and you get an enlarged lymph node at that proximal area, so basically closer to the heart, then that could be that particular infection. I spoke a little bit about Bartonella, I spoke a little bit about Babesia as some of those specific symptoms. But oftentimes it's hard, and it's also, they also feed off of each other. So infections will feed off of heavy metals and chemicals. And so oftentimes we have to get rid of heavy metals and chemicals first in order to go after the infections. Or mold is hijacking the immune system. So the immune system can't deal at all with Lyme or these other infections. There's actually some studies to indicate that if you treat mold, sometimes Lyme goes away. And if you treat Lyme, sometimes mold goes away. So, it's this hodgepodge, and they're all having this effect on the immune system. They're all hijacking the immune system. So
they're all like overwhelming the immune system such that it can't really it can't mount enough of a response to actually take care of, say, the hidden infection if it's being bombarded with mold and chemicals and heavy metals and things of that nature.
Yep.
Gotcha. So do you recommend that pretty much everybody who's suffering from fatigue who comes into your office, do you recommend that they try to address hidden infections as sort of removing that nail and do some treatments to address that?
It really depends. So, there is this spectrum. So like you're talking about with your course, you're getting people who have fatigue who can be remedied with sleep and circadian rhythm. And I've gone about through half of your course, so I don't know everything yet, but I think you get into mitochondrial function and some of this other stuff. And then the next step is nutritional deficiencies. So I didn't talk about that yet. But nutritional deficiencies, we talked about like hormonal deficiencies, but nutritional deficiencies oftentimes can heal a lot of stuff. So B12 deficiency, vitamin D deficiency, other B vitamins. There's a number of them that, we do a NutriVal test, which is wonderful for looking at all of the potential nutrient deficiencies, magnesium and molybdenum and all this sort of stuff. So I will first start with replacing what's deficient. That's kind of, I always like to make people strong first, because if we're going to go after the usual suspects, you have to be strong in order to be able to do it.
Right.
Because, there's die-off with these infections, and your adrenals have to be good, your thyroid have to be good, all of your nutrients have to be replaced in order to be able to go through the process as gracefully as possible. That's really my goal, is to help people get better, faster, and safer, and there's a lot of Lyme doctors out there who are doing really good work, but when you really focus just on the Lyme, and you're hitting them with, antibiotics or antimicrobials or whatever it is, and you're not supporting the adrenals, you're not supporting the nutrient deficiencies, you end up picking up the pieces at the end. So basically, it may take you another year to boost them back up to where they need to be. So what I like to do, and I find that this is really successful, is to keep them strong. So replacing those nutrient deficiencies, replacing the hormones, and then going after the usual suspects.
Nice. Okay, so take me through, I guess, what you would, let me put it this way. Let's say I come to you and I'm struggling with fatigue. And I'm, you tell me everything you just told me, and I start to go, I feel like I've had some swollen lymph nodes. I've had some of these other symptoms that you've mentioned. And how can I start figuring out which of these factors apply to me, and how can I start addressing them? Can you take me through a little bit of some of the more practical steps as far as diagnosis and treatment?
Absolutely. So I I would start off by doing some labs. So we work with a company called True Health Diagnostics for our blood testing, which looks at cholesterol and inflammatory markers and blood sugars and nutrient deficiencies. This is all in blood. And then we look at Genova's NutriVal test to look at nutrient deficiencies. It also has some really good mitochondrial markers, stress markers on the mitochondria, which is the energy center of the cell that can get damaged by all of the usual suspects. Mm-hmm. I just learned recently at a conference that mitochondria is also a modulator in its own right. So it modulates the immune system. It actually can improve thyroid function by modulating the enzymes that allow thyroid to get into the cell. So we're learning all of this wonderful stuff, that's coming out right now. So that's the True Health and the NutriVal. And then to look at infections, I would look at Medical Diagnostics Laboratory. They do a really good job at looking at serology, so basically immune system reactivity to infections. There's other labs that might be better, but they're a lot more expensive, and the Medical Diagnostics Lab does a really nice job for the price, and it gives us a lot of really good, useful information that we can use in order to help the patient.
Okay. Real quick to interrupt you, are these diagnostics that people who are listening right now can go and do on their own?
So the way that they would be able to do those would be to go to directlabs.com.
Okay.
So that's kind of like a third party that has a physician attached to it that allows people to purchase them.
Okay, and you say the ones they would want are the NutriVal, the Health Pro, was it?
Well, the True Health Diagnostics, I'm not sure that they can get through there. You'd probably have to go through your local lab for that.
Okay.
You just need somebody to write the order for that. The Medical Diagnostics Lab may be on that.
Okay.
I'm not entirely sure. I'm not sure what they have for infection testing, at least in blood.
Okay.
But the NutriVal test, I'm pretty sure that they have, and that's by Genova.
Okay. Okay, so is there a way for people listening to get tests for, say, hidden infections or heavy metals, for example?
Yes. So for the heavy metal test, I recommend using Doctor's Data test. Okay. Now, Doctor's Data, you have to do a before and after provocation challenge test. So the before is basically you wake up in the morning and you urinate, and that tells you what's floating around in your bloodstream. And then you take a chelation agent, which oftentimes is DMSA or DMPS, or even in some cases zeolite. And then you collect your urine for the next 6 hours. So that's the second kit. And that's going to pull out the heavy metals from the tissues and give you a tissue burden analysis. So that's going to, you're going to see this really significant increase if people have significant heavy metals in the tissues, because that's where they like to live. You're not going to see the heavy metals floating around in the bloodstream. You're going to see it in the tissue. So you have to do this challenge test. And that one is on that Direct Labs website.
Okay.
Now, in terms of the infections, I'm not sure that you can gather that. So for folks, as I take them through my program, virtually, so I'm creating an online platform, online courses to take people through this, hold their hands and whatnot. We're going to be using mostly clinical diagnosis, which the Center for Disease Control says is appropriate in Lyme and Lyme co-infections, because those are more specific. It's easier to kind of to do that with a lot of those. So some of those infections are easier to do clinically, and you don't necessarily have to do the testing.
Gotcha. Okay, so explain a little bit more about what that means. What does that mean to do it clinically versus via testing?
Sure. So a clinical diagnosis is a diagnosis made by the physician based off of your signs and symptoms. So basically the questions that I ask you, your responses to that, and then the exam that I do on you. So that's the gist of it.
Okay, so is that something you're going to do in your course as well? You're going to walk people through a process. So for people who might suspect that hidden infections are a problem for them, how can they, I guess, start to go about addressing that on their own? Is there any way where they can figure out how to diagnose or treat them themselves? Yeah.
So, well, one of the things that I am going to do through the course is I'm going to discuss if you have these symptoms. So I'm going to do it based off of symptoms for what I do in my clinic with my patients, and not necessarily off of the signs, because I'm not doing a physical exam on people. But the thing to remember too is that these tests are not 100%. They are highly imperfect. So the infection test that we're doing is a serology test. It's looking at the immune system's reactivity to a certain infection.
Okay.
If your immune system has been hijacked by one of the usual suspects, all bets are off. So one of the things that we see is that people will come in and they'll show no infections, and I'm like, I know you got infections. And we start removing the usual suspects, and all of a sudden, as the immune system starts to come back online, we repeat the test, and all of a sudden there's a positive test for the infection that I thought that they had.
Interesting. So that doing the diagnostic tests are not necessarily that needed. They're not that critical. It's more if you have some of these symptoms, it doesn't hurt to start removing those nails, just as, with the hunch that they probably are there in some form or another.
Absolutely. And, we like to test because, it helps for the clinician. We say, don't guess, test. It helps for the patient so they can actually see, they can get some sort of definitive tool instead of taking my opinion like, yeah, you've got these symptoms, you've got this infection, let's treat it, and you're going to spend this much money and spend this much time going after this infection. As humans, we just like to see that data, even though that data may not be perfect. It still is reassuring that we're on the right path.
Gotcha. Okay, so let's say someone has some constellation of these things, and I know you had said it's usually not just one, it's a combination of sort of all of the usual suspects, or at least several of them. What does it look like as far as starting to address these factors, starting to pull some of these nails out?
So we always like to go with the low-hanging fruit first. Now, this is after we replace all of the nutrient and hormonal deficiencies. And so once you have the person stronger, so if people come in and they say their energy is like a 2 out of 10, with 10 being ideal energy, generally, as we start to replace all the nutrient deficiencies and all the hormonal deficiencies, we can get them up to 5 or 6 out of 10. Oftentimes they're able to go back to work. And some people that can get them all the way up to 8 out of 10. It really depends on what's going on. And then we go into the usual suspects. And I like to get rid of heavy metals and chemicals first, and set up good detoxification pathways. So utilizing glutathione, which is the body's main antioxidant and detoxifier. Utilizing different binders, so zeolite or charcoal, from a more natural perspective. And then going after the infections. Now, sometimes, people are really chemically sensitive. They come in, they can't tolerate much of anything that I'm giving them. Because of the infections that are present, sometimes I have to go after the infections right away. Otherwise, we're not going to get anything done. But ideally, it would be, this process of removing, as I say, the crap off of your immune system, and we're just taking layers of it off. And while we're doing this, we're also preventing stuff for the future. Not only are you going to feel better now, but it helps prevent Alzheimer's. 7 out of 10 Alzheimer's brains in one study had Lyme in it. It's going to prevent Parkinson's. There's more and more research coming out about chemicals and Parkinson's and chemicals and diabetes. Pesticides are very quickly becoming a major cause of diabetes in this country.
Yeah.
So, as much as we can remove off of the immune system, off of the liver, off of the nervous system, the body it goes through some uncomfortable periods, but it just keeps on getting better and better and better.
Gotcha. So you mentioned charcoal, zeolite, and I think there was one other one in there.
Glutathione.
Glutathione, that's right. And so what are these compounds? Can you talk a little bit about what they're actually doing in the body? I know glutathione is involved in detoxification, and it's an antioxidant. What are some of these other things doing, and do they detoxify sort of everything universally? Do they get at mold toxins, or is it more chemicals? What are your preferences on sort of how to use those different substances?
Absolutely. So The way that I explain glutathione is that it's opening up the pathways in the liver. So as we're going through this process, if you are binding up and trying to remove things, but you can't get it out of the liver, you're going to feel worse. So we have to open up those pathways. And, glutathione is great for doing that. Taking your B vitamins, B12 and folate, will bypass MTHFR and some other genetic SNPs, genetic issues that you may have in terms of detoxing through methylation, which is phase 2 of detoxification. So we'll just take a step back here. So phase 1 detoxification, you want to make sure that you're eating a really clean diet. You want to make sure you're getting enough amino acids for this process, getting enough leafy greens. And then phase 2, you're getting more into methylation and then transsulfuration. And methylation is B vitamins, which will decrease homocysteine levels. It's another great marker that we look at for improving methylation and detoxification function. And then in transsulfuration, the main product is the glutathione. So that's just kind of a brief overview about detoxification. And then phase 3 is elimination. So it's getting it out of the stool, out of the urine. And if you can't get something out of the liver, if you can't get it out of the urine, if you can't get it out of the stool, it's going to come out of the skin. So when people start to get rashes, when they start to sweat more, oftentimes we'll use saunas as another means of getting things out. Coffee enemas are great because they will cause the liver to start to dump a whole bunch of stuff. So there's Essiac tea is great for liver detoxification and has also been shown to be helpful in cancer therapy. So there's a number of tools that we will use in order to improve those detoxification pathways. So number 1, detox.
Okay.
Go ahead. Did you have a question?
Yeah, no, you were going to take us through something there, so I was kind of interrupting. You go ahead.
It's okay. So so number 2 is heavy metals. So I've used a number of different things over the years in order to get rid of heavy metals. And I like to do things safely. So I don't do rotational chelation. I like to do slow, steady chelation at a lower rate. I like to take about a year to get people's heavy metals out.
Oh, wow.
Just because I've seen that when you go hard and heavy, that you get, not only does it bind up your minerals, which can cause other problems, but you can also get redeposition. Now, what this means is that, like we talked about, heavy metals are in the tissue. You start to pull it out, and you pull it out of the tissue, it goes into the blood, and then if it's not bound up appropriately, or there's too much coming out at a time, guess what? It goes right back into another place. And if somebody's got brain fog and you start to chelate them, and all of a sudden they're getting more brain fog because you've just redeposited into their brain, it doesn't feel good as a clinician, doesn't feel good as a patient. So in this case, slow and steady wins the race. And so I like to use things like zeolite or things like lipoic acid. And those are really great.
What's that? Alpha lipoic acid?
Yep. Alpha lipoic acid is a natural chelator in its own right. So, so not only does it boost the mitochondria, but it also chelates naturally.
Okay. So a couple questions on details here. One, I listened to an interview recently with a guy named Dr. Vincent Pompa, I think was his name. And he promotes some product that is a zeolite-based product that he says, I think that the selling point on it was that it was like micronized and it was smaller molecules that can actually get into the cells. And he was drawing this distinction between detoxifying at the blood level or in the gut versus actually like getting across the cellular membranes, across the mitochondrial membranes, and being able to detox on that level. Have you read anything on that or have any insights into detoxing at the cellular level as opposed to the gut or the blood?
Absolutely, yeah, and I like to use a Nano-Zeolite, which is very similar. And you always want to, if you've got some data to see if it works, that would be great. I've seen this product, they've done some case studies before and after urines, like we talked about with doctors' data. And they found in one patient a 5,400 increased excretion of mercury utilizing this particular product, and then 1,000 increase excretion of lead 500% increase in some other in cadmium or arsenic or something like that. So you want to see some data with these products. I'm not familiar with that product. It might be the hydrolyzed zeolite that I think I've heard about, that I'm very interested in looking into, because I've heard good things with some colleagues of mine who I respect a lot. So generally the zeolites will stay just in the gut, along with like bentonite clay and stuff like that. And they may pull a little bit out of the tissues, and you'll still get some, but you're looking at probably 5 years of detoxification instead of a year or so. So utilizing something that can get at the cellular level is definitely advised.
Gotcha. Okay. So would you recommend doing some of the gut-based detoxification? I assume charcoal is more gut-based. Bentonite clay mostly stays in the gut. So what we're really talking about is sounds like a combination of stuff that acts more on the gut and the blood versus in the cells as well. And I guess the nano-zeolites are mainly is that the main thing that's actually going to get into the cells and detoxify on that level?
Correct. At least what I use.
Okay. And do you have a specific brand recommendation on that, or? Actually, one thing I've read on zeolites is some of them are contaminated with lead. And do you have a good source for one that maybe is not contaminated and has these case studies to support it as well?
Absolutely, yeah. I like the Results RNA products.
Okay.
Yeah.
Cool.
And people can get those from my website if they're interested in going there. It's fixyourfatigue.org, and you can click on the shop and create an account and purchase that stuff. A lot of these products are practitioner-only products, so you can only get them from providers.
Okay.
So that would be a good one to get. And there's also like free shipping and stuff like that on there too. And the alpha lipoic acid brand is Biotech. There's really only 2 brands that are recommended, Biotech and Metabolic Maintenance. And that's on there as well. And then I don't think I answered the question on charcoal. So then charcoal I use for molds. So it's great for binding up mold spores and mycotoxins. So the concern with mold is that you can get, mold spores are like 0.3 microns in terms of their size, but mycotoxins are down to 0.003 microns. So they're just very small, very hard to get rid of them. And so there's a number of other things that you kind of need to do when you're going after mold, but charcoal and glutathione are really mainstay treatments.
Gotcha. So is charcoal mainly acting in the gut? I mean, it's obviously you ingest it, and at that point, do those compounds stay in your gut, or do some cross the gut membranes and act in the blood as well?
Correct. They do get into the blood.
Okay. Interesting. So compounds from the charcoal itself are now acting in the blood and working to bind things up in there.
That is my understanding. I mean, we do see systemic improvement, where people are getting improvement in their symptoms when they're taking it. And so I have to believe that that's happening.
Gotcha. Okay. So, so charcoal, zeolite, and there was one other one, glutathione and alpha lipoic acid. Anything else worth mentioning there?
I'm trying to come back to the original question. I'm trying to remember what it was.
Just detoxifying metals and biotoxins, chemicals.
Gotcha. So we were doing the heavy metals, the chemicals. And the nice thing about zeolite is that it's going to get heavy metals and chemicals. Okay. Now, all this is not if you haven't changed your environment. So if you're still being exposed on a regular basis to mold, if you're still being exposed, by from your cosmetics, unfortunately, there's just so many products out there that are constantly exposing us to stuff that we have to just really become mindful about. If for women, I require all of my patients, or ask all of my patients, to go to, I think it's skindeep.org from the Environmental Working Group. And they can put in their cosmetics, and it'll tell you what the toxicity of that is. There was some study that came out, I think about a year ago, that looked at lipsticks, and about 70 to 80% of all lipsticks on the market had a significant dose of lead.
Wow.
So it's really important to get all of your products verified through that website. And then you can look at, you can look at which ones are ranked the best. So have 0 or 1 toxicity as opposed to 10 toxicity. So you can go and then you can purchase those products.
Yeah, interesting. So let me ask you a question. I just had a thought in my head as you were talking. When I transitioned from like typical American boy using all the standard, I mean, like shampoos and conditioners and, skincare products and things like that. And when I started to become more health conscious and more aware of all these different chemicals and stuff like that, and transition to all very natural methods of, washing my hair, brushing my teeth, cleaning my skin, washing myself in the shower, and really paid attention to using only very natural stuff, I noticed that I became much more sensitive to chemicals. Like when people walk by me who are covered in perfume or the shampoos and stuff, it like overwhelms me to just to smell them. And not that I like have negative symptoms from it. It just kind of blows my mind that people are dousing themselves with so many different chemicals all the time. Do you find that that's common, that as people get this stuff out, that they become much more sensitized and aware of all these different chemicals in their environment?
Absolutely. Yeah. And it's the challenge of clean living,
mm-hmm.
Where, this is just incredibly common. And the question is, why does that happen? And maybe it's because there's toxicity that you're removing from your olfactory bulb that, causes your smell will be more sensitive. But it seems like, as we get more and more bogged down with all of these usual suspects, our body kind of turns down the volume so that we are not affected so significantly. Mm-hmm. And then when you start living clean, the body's like, oh, good, everything's working better. And now I can react more with my environment. And now you get more signals about what's toxic and what's not.
Gotcha. Interesting. Yeah, I was wondering about that.
That's my theory.
Yeah, that makes sense. So a couple more questions on detoxification. So one is cilantro and chlorella. I've heard something to the effect of, I'm trying to remember the terminology that was used, but it's like partial binders versus complete binders, something to that effect, talking about how these things may bind, but they don't effectively remove it from your body. Do you know anything about that? Are cilantro and chlorella effective means of detoxifying heavy metals, or are they kind of not so effective?
Well, when I was going to school in Ohio for undergrad, we used to play euchre, which is like it's like a hearts game, or it's a trump game. And there was a strategy in there: don't send a boy to do a man's job. Where if you want to get the job done right, it's got to be strong enough. And so, with cilantro and chlorella, it's kind of like, you can get rid of your heavy metals and chemicals. It'll just take you 5 or 10 years of doing it. So
gotcha.
If you do it more potently, but as safely, that's always the goal.
Gotcha. Okay. And then one last question on detoxification. What do you think of using a sauna in conjunction with niacin? I've heard something to the effect of that using a niacin prior to getting in the sauna may help more effectively remove the toxins.
Yeah, so a lot of our toxins are stored in our fat cells, which is why a lot of people can't lose weight, is because the body's protecting us, actually. So what ends up happening is that the toxins get into the fat cells, and then to protect us, the fat cells get bigger. So the way we gain weight is either with bigger fat cells or more fat cells. So when you start to remove the heavy metals and chemicals and toxins and whatnot, those fat cells will start to shrink. People oftentimes will lose weight. And the same thing, it's similar when you're doing that with the niacin. Using immediate acting niacin will cause those fat cells to explode, or basically to lyse and open up and kind of leak their contents out, so that you can bind them up. Or you can get them out utilizing a sauna. And so if you're going to do the immediate acting niacin, I do recommend that you combine that with utilizing like a zeolite or charcoal or modified citrus pectin or something like that after the sauna.
So that's because niacin's opening things up and releasing these toxins, but then you want to introduce something to help actually clean them up and get them out of your body.
Absolutely.
Okay. Cool. So good stuff on detoxification. Let's go into,
One more thing. And one note on sauna, I do recommend a far infrared sauna because it detoxes at the cellular level. But any sauna that, you know, causes you to sweat is going to be good. I have some patients who come in who can only do 5 minutes in the sauna.
yeah.
And then we just kind of increase slowly. It's a wonderful detox support. You know, all of us should really have saunas in our backyards, like a lot of European countries do.
Yeah.
Yeah.
I actually, just before I got on the call with you, I was just in my far infrared sauna.
Nice. Awesome.
Yeah. So we talked about detoxification, getting rid of heavy metals, biotoxins, things of that nature. Biotoxins kind of wrapped up in that. The same things that will detoxify heavy metals will also get at biotoxins. Is that right?
Not exactly. So, you know, biotoxic illness can be mold, Lyme, or heavy metals.
Okay.
So the mold treatment's going to be a little bit different, and the Lyme treatment's going to be a little bit different than what we discussed. I mean, we're discussing heavy metals and chemicals.
Okay, gotcha. So is there any more specifics that we should get into around biotoxin, or is that really just?
Yeah, no, I think that would be great. So in terms of mold, I want to come back a little bit, touch on the testing, because I didn't get to talk about mold. You know, we always want to see what's in the environment for mold as well as what's in the human. So the best test in the human is a urine mycotoxin test by real-time laboratories. I don't know if that's on directlabs.com, but you can check it out. But this is looking at those mycotoxins. So basically those 0.003 micron toxins that are really causing a lot of the problem inside the human. And that's something that's a test that we like to use to determine when do we stop treatment. So that's a great test. There's also you know, testing in the home that we want, and that can be done by real-time labs by taking an air sample. The best test is an ERMI test, ERMI. Excuse me. I think it's by a company called Mycometrics, and it's pioneered by Dr. Richie Shoemaker, who's a big mold guy, and it's looking at the DNA of the mold. You can also do mold plates that you find at your local Lowe's store and stuff like that, and it's a pretty good test. You know, if you've got mold on those mold plates, you know you've got it, but if you don't, it doesn't mean that you don't.
Gotcha.
And so we always, it's nebulous, it's hard to figure out, it can be hard to treat, and it's really challenging to remediate your home. You know, if you've ever had any sort of water damage in your home, any flooding, you know, you have to evaluate it for mold. You have to take mold out of the equation. One of the ways you can test and see whether or not your home has mold is to go on vacation. Mm-hmm. So if you go on vacation and you feel better, you know, you go to, I don't know, Hawaii or something. Hawaii has a lot of mold because of the moisture, but if you go on vacation for about a week and you feel better, maybe it's not because of your job, you know, and that you're like, oh, I feel better because I don't have the stress. Maybe it's because you have something wrong with your house. You have sick house syndrome. So then those mycotoxins also get in all of your clothes, and they get in all of your furniture. So when you leave that home, you actually have to leave. It's recommended to leave all that stuff. And I have seen people who don't leave all their stuff, and they basically take the mold with them. So wow. Mold is a big old can of worms that absolutely has to be addressed.
Gotcha. And so the main strategy there is about addressing it in the home rather than in your body necessarily.
Well, you got to do both.
Okay. So
you got to address it in the home, and we can address it in the body at the same time. But you just can't be exposing yourself on a regular basis. And it's so amazing to see people get out of their homes and see the improvement in their health. You know, while we're doing the glutathione and doing the binders like charcoal or modified citrus pectin, and sometimes high-dose IV vitamin C and oxygen therapy, ozone therapy. So there's a number of things that we'll use in order to get the mold out, depending on where the person is at in the process.
Gotcha. So in the house itself, this would be mainly a matter of bringing in like a mold specialist to identify, or using the mold plates or something like that to identify if you have that issue, and then bringing in a mold specialist to identify where it's coming from, maybe clean it out or something to that effect?
Yeah, there's your best bet is to find a building biologist. So if you Google that in your area, there are some organizations that train these building biologists, and sometimes they have they have enough training to come in and counsel you about EMFs as well, which is really awesome, and a whole nother ball of wax. But yeah, the challenge with the mold specialists is that oftentimes you can spend 10 grand on a remediation and it's not done right.
Gotcha.
So they may claim themselves to be a mold specialist, but if they don't have a guarantee, like you really want somebody who's going to do before and after testing, and that if afterwards, if they repeat the testing and it's the ERMI test or it's a real-time labs air test, and it still shows up positive, that they do it again for free.
Okay, that's good advice. What do you think of air purifiers? Having like an air purifier in your bedroom, is that a good idea as well?
That's a great idea. Now, the only air purifier that I know about that gets down to the 0.0003 microns is IQ Air. So IQAir.com is great. If you mention my name, you get, I think, 10% off, and I don't get any money for that. So, enjoy it, use it. They are quite expensive. They're like $800, $900, but they're wonderful. They'll take 1,000, 1,200 square feet, and they can completely remove it from mold and mold toxins. So if you can't get out of your home, if you can't remediate, you spend the $900, you get this air filter, and you wheel it around your house as you need to, and you just make sure that you're taking care of yourself.
Okay, cool. Okay, so now we've covered heavy metals, we've covered chemicals, we've covered biotoxins. The last one is hidden infections. So I know that this is a hugely complex area, and it really depends on which specific infection that we're dealing with. But do you have any practical recommendations for getting rid of hidden infections in the body?
Yes, and this is one of my favorite things to talk about, because the results can be so dramatic, and as we get better and better tools, we see faster and faster results. So the Cowden protocol is a really good protocol for doing this. It's a combination of Banderol and Cemento that you can also get through our shop, and it can get rid of Lyme and its co-infections. It's not perfect. It doesn't work for everybody. And I should back up and say, we always want to go for the low-hanging fruit first. We want to go for Lyme last, because some of these other infections, I call them the gateway bugs as opposed to the gateway drug, but the gateway bugs, where they will hijack the immune system and they will mess with it, and then you won't be able to get rid of the Lyme if you go directly at the Lyme. So you have to get after the Epstein-Barr, the Bartonella, the Babesia, the Ehrlichia, HHV6 virus, like all this stuff first before you go after the Lyme. The other thing is you have to go after gut bugs before you go after blood bugs. So we talked, mainly up to this point around blood bugs, Lyme and all that, but there's bugs in the gut. There can be yeast, there can be, E. coli, there can be Proteus, there can be Klebsiella, there can be a number of different infections that are in the gut that aren't supposed to be there. SIBO, small intestine bowel overgrowth, is in the gut. It's in the small intestine. The other ones that I mentioned are mostly in the large intestine. There can be infections in the sinuses. So Mayo Clinic came out with a study a number of years ago saying that 30 to 50% of all chronic sinus conditions are yeast. Well, I've seen that it's yeast. It's mold. It's something called MARCONS, MARCONS, which stands for multiple antibiotic resistant coagulase negative staph. Wow. But basically any antibiotic resistant bug that's up in there. So so there's a lot of these different infections that can kind of hijack the immune system that have to be taken care of before you go after the big mama, which is Lyme, or otherwise known as Borrelia.
Interesting. So you're seeing people with co-infections who have lots of different layers of these different infections going on, and not just Lyme, but some of these other viruses as well.
Yes. Wow.
Interesting. Okay. So you go after gut bugs before blood bugs. What does this look like in terms of more practical steps, more specifics?
So If you're going to go after yeast, there are some natural antifungals that can be helpful. It has to be combined with a good probiotic and a really good diet. So the diet is very challenging for many people. Has to be done for 3 months. Oftentimes it needs to be done for longer than that. But it is a grain-free diet. It's basically meat and vegetables, low glycemic index, low glycemic index diet, and then with a probiotic. So I like a probiotic called Therabiotic Complete by a company called Claire Labs. And then the antifungals are a product called Yeast Formula, a product called Phytostan, and they can be good. Though a lot of times I have to get my patients on prescription antifungals. So we're talking about diflucan, which always has to be taken with. Gaia has a nice daily liver formula product because diflucan can damage the liver, and nystatin, which does not damage the liver, but it's not as strong as diflucan. And oftentimes I have to combine both of those. I find that that's the best way to not waste any time, is to do both of those, do the diet, do the probiotic, and generally in 3 months, you can get rid of yeast.
Okay. That will get rid of yeast not only in the gut, but also in, say, the sinuses as well?
It can definitely help out there. And sometimes you have to do like nystatin flushes, or you have to get some sort of antifungal up into the sinuses. And then yeast also is very hard to test for, so you might not find it in your stool. But if you have itchy ears, if you have itchy anus, itchy skin in general, if you have depression, if you feel worse when you consume sugary food, including fruit, you may have yeast, or you have chronic yeast infections, if you have toe fungus. All of those things indicate that you most likely have a yeast problem and you need to be treated.
Interesting. Okay, so that's how you address the yeast. What's the next layer?
So the next layer is the other infections that are in the gut. So there's several products that I like for this. GI Microbe X by Designs for Health is a good product. And then Parabiotic Plus by Biogenesis is a good product that I like to use. And generally that'll take 3 months or so with a good clean diet in order to get rid of that layer.
Okay. So that's addressing bacterial issues mainly?
Correct. And those are a combination of herbs, much like the other antifungal complexes are.
Okay. And then is there another layer around parasites to this as well? Or do you find parasites are a big problem for a lot of people?
They definitely can be. And those are addressed with what I just mentioned.
Okay. Mm-hmm. And what's next?
So the next step would be going after the sinuses.
Okay.
And so depending on which bug is present, we may want to use a BEG spray, or basically a combination of different antibiotics that have to be compounded that need to get up in there. But we're having a ton of success utilizing sinus ozone. So this is something that people can do at home, and we'll kind of, because the rectal ozone can be really great for dealing with a number of these infections long term. So you can purchase a setup for about $1,000 and get your own ozone at home, and you can fill up a syringe, and you can put it up into your sinuses and do it several times a week.
That's ozonated water? Is that what you're going to use there, or? No,
you're just going to use ozone. Now you have to follow specific instructions for doing this. There's a guy on YouTube, Truly Heal is the name of his website, name of his channel. I can't remember his name, but he does a very nice job of kind of training you on how to do this. We never want to breathe in ozone, and this isn't the ozone in the atmosphere. This is basically activated oxygen therapy. We never want to breathe it in. So when you're doing it up the sinuses, you have to take a deep breath and then put it into the sinus, and you hold it for as long as you can. And you can kind of feel it because it's a gas. Some people are using this for treating brain issues. So they're treating Parkinson's and dementia. It goes up into the ears. We had one patient who I just saw the other day who's been doing it like 3 times a week. And when she first came to see us, she couldn't hear out of 1 ear for the last 4 years because of a mold exposure. Wow. So once we started doing the sinus stuff, She's now a month later, she can almost hear entirely out of that ear.
Wow. Awesome.
Yeah.
Yeah. So the reason that I asked if it was ozonated water is because I know that ozone gas is toxic to the lungs. So what you explained makes sense, that you're taking in a deep breath, you're holding and then putting the stuff up there, and then you're exhaling it all out. Is that right?
Yeah.
Okay.
And all of this stuff I recommend that you do with a physician. You know, there's nuances to all this. You can get in trouble taking these things, you know, in the improper doses and stuff like that. And I'm going to do my best in the classes that I have to train you best that you can. But you have to find somebody knowledgeable in this sort of stuff and follow their recommendations to a T, so that you can get the biggest bang for the buck.
Yeah, for sure. And there's obviously a ton of complexity and nuance to all the different things we've talked about to this point. And I think everybody would be smart to get professional guidance for doing any of this. But I think it's also, at the same time, I think it's awesome that people are hearing this blueprint for how you approach things very systematically and progressively, because I know so many people out there are just, there's this tendency, I think this human tendency towards finding the one thing. You know, we need, it's this one treatment. It's, high dose IV vitamin C therapy. And that's the thing that's going to cure all your problems. And, or it's this supplement, or it's, whatever. We all want, it's this diet, we all want this one thing. And I know that there's so many people out there who are just trying one thing after another, after another, after another. And they basically just jump from one thing to the next. They're like, okay, well, that thing, I thought it worked for a few weeks and then it stopped working, and this thing worked for a few weeks, and they end up just wasting their time for years. And I think it's awesome that people are hearing from you that, there's this blueprint. You need to address all these different layers of the puzzle very systematically and intelligently. So yes, get professional guidance on all these different steps, but have this blueprint in your head for how to go about the big picture of actually getting real results.
Yeah, I'm glad that you said that, because I mean, that's huge. And it may be that if the treatment works for your friend and then the treatment doesn't work for you, it's just because you're not treating the right cause, or that treatment may work for you, but it may work for you several months down the line.
Right.
And I do want to be clear. I do have to say that, I am not treating anybody who's watching this. We do not have a therapeutic relationship. That this is just based off of, this is just education, and it's based off of my, what I do with my patients.
Yes, absolutely. Yeah, and I think that's clear, but I'm glad that you said that, just in case it wasn't. So is there any other layers to the story that you would address after? What was the last thing we talked about? What was it?
Sinuses.
The sinuses, the sinus ozone. I know we had talked about on the phone at one time. You had just finished doing an IV ozone session on yourself. Can you talk a little bit about IV ozone?
Absolutely, and that kind of leads into the next part. So we talked about infections in the gut, infections in the sinuses, and then we would be able to deal with infections in the blood, of which we use IV ozone or rectal ozone, which you can, if you get this stuff at home, you can utilize that rectal ozone for the rest of your lives. You get a sinus infection, you get an ear infection, you want to treat your bugs. Ozone is amazing. It's we just talked about not having a panacea, and ozone is not a panacea, so it doesn't work for everything, but it's the closest thing that I have found. It's activated oxygen therapy, so as soon as it hits the blood, or as soon as it hits the mucosa, it's going to be converted to oxygen, and it's been shown to decrease inflammation. Number of inflammatory markers go down. It's antimicrobial, so it kills bugs. It can detox, though it's not going to be able to detox your heavy metals completely, maybe over the course of 5 or 10 years, as well as chemicals. It rebuilds, it boosts mitochondrial function by several 100%. So it's just, and then it also, it heals a lot of vascular injuries. So it's just a wonderful treatment all the way around. Doing it IV and then doing it rectally at home are great options.
Cool. So IV would only be in a doctor's clinic. Is that correct? Okay. But rectal and the sinus options are something that could potentially be done at home if you have an ozone machine.
Correct.
Okay. Also, so just a question on the mechanism here. You said it turns to oxygen as soon as it hits the blood or the mucosa. So how does it actually exert, say, antimicrobial effects if it's just oxygen in the blood?
Oxygen does that. So in 1933, Otto von Warburg showed and won the Nobel Prize for proving that cancer could not live in an oxygenated environment. And since then, a lot of his students have kind of proven, how oxygen is a natural antimicrobial. So one of the things that happens is that there's this preservation, this survival that effect that happens inside the human organism in order to protect itself. And so it clamps down on all of its vasculature. And so the infections are basically dictating this, and so that they can live in thick blood and create their biofilm and all this sort of stuff. And when you start adding oxygen and you start increasing the blood flow throughout the body, that ends up breaking up a lot of the infections, and it has some antimicrobial activity on its own, but then it also allows the immune system to start killing off the infections.
Interesting. Well, now that you were talking about circulation, what immediately popped into my head was saunas, and I wonder if there's any synergism between, say, ozone therapy and sauna use to really increase circulation even that much more.
There definitely is. There are ozone saunas.
Oh, interesting.
And they also will combine pulsed EMF in some of those. The other thing about saunas is that the far infrared sauna actually kill infection. The wavelength that the far infrared is on will cause antimicrobial activity.
Really?
Mm-hmm.
Wow, that's cool. I didn't know that.
As will raising your temperature. So the old phrase, what is it? Starve a fever, feed a cold.
Yes.
There it is. I starve everything, I starve everything, and you want to heat everything. So the body functions better when it doesn't have to eat, because eating takes up a lot of energy. So if you can use that energy for your immune system, so fasting on liquids and then getting really warm, increasing your body temperature causes the immune system to function better. So that's why you get a fever. And so the more fevers that you can have, whether it's going into a sauna or taking a hot bath with some Epsom salt or whatever, those can be really helpful for killing infections too.
Gotcha. Okay, just a quick note. I think we both actually got that backwards. I think it's feed a fever, starve a cold.
Thank you.
Yeah. Okay. Okay. Awesome. So, is there any other? I think we've covered just about all of the usual suspects and how to actually, go about fixing them. Understanding that there's some nuance and complexity, and that it's best to do all of these things under professional guidance. Is there any other things you think are worth mentioning here? We've talked about hidden infections, we've talked about biotoxins, we've talked about chemicals and heavy metals. Anything else that you want to mention on top of all the strategies we've discussed?
I would like to touch on just a couple things. So we haven't talked about sleep. We haven't talked about exercise, which you do a really good job of those things. One thing I would like to mention about sleep is that I get more people to sleep at night by giving them things in the morning than I do by giving them anything at night. So generally, if they're deficient in these things, B12, adrenals, thyroid, iron, I give those in the morning. Iron is separated from thyroid by 2 hours. But if I give all those in the morning, that will help people sleep at night. Now women who are menopausal, they'll still generally need progesterone to help them fall asleep and estrogen to help them stay asleep. But if they've done all of your tools and techniques, their circadian rhythm they feel like has been fixed to an appreciable degree, they're doing everything, and they're still having issues, it could be that they have these nutritional and hormonal deficiencies that might be playing a role. And then infections also will play a role. So infections are really active at night. So they'll wake people up throughout the night sometimes, and oftentimes to urinate. And people will say, well, I have to get up to urinate. And that's not the reason why you're getting up. You're getting up because you're not getting into deep sleep. and then your body is not shutting off the need to urinate. You're not going into your parasympathetic, where you're sleeping, and so the body, you're awake enough to be woken by a full bladder. You should be able to drink 20 ounces of water a half an hour to an hour before bed and not have to wake up throughout the night. And that's because the mechanism for urine is shut off while you're sleeping.
Mm.
So the infections, as well as those other things that I mentioned, will affect your ability to get into deep sleep. And as we treat all of those things, then sleep will greatly improve.
Cool. Interesting. Another layer I did not know. So thank you for educating me at the same time here. So that's really, yeah. I as you were talking, I was having recollections of so many people complaining of that exact symptom. And, I'm trying to address it through lots of other strategies, but that's one piece of the puzzle for me that I'm sure has been going on in some of these people that I haven't been effectively addressing. So awesome. And sleep obviously is just massive. I mean, if you're not sleeping well, none of these other things are going to work. You're not going to fight off. In fact, your immune system is not going to work well enough to fight off infections and detoxify and do exercise or really function at all if you're chronically sleep deprived. So yeah, that's huge. So awesome. I think we've covered just about everything here. Any other last bits that you want to add here, or have we pretty much covered it all?
Well, I'll say one little thing on, one last thing on sleep and then one little thing on exercise. So I tell my patients, I've never seen a patient with fatigue get better if they're not going to bed at 10:30.
Yeah.
So yeah, you have to do that. And then with exercise, it really depends on your intolerance to exercise. I have some people who do 5 jumping jacks a day because their fatigue is so bad. And some people, they can't do anything. Yeah. But, doing something, you talk about movement, and it's so important. If there is a panacea, it's exercise. We know that exercise modulates so many things, it improves so many things. And if you can just, if you can prioritize it and you can do it, that's awesome. And I guess the last thing I would say is, it really is all about the foundations. My wife has a website called Life Takes Practice where she talks about more about these, but that you've also mentioned. But sleep and nutrition and exercise are all huge. And then managing your stress and maintaining your communities and your social, all those things are just so super duper important. And you have to foster. It seems overwhelming, but you have to foster all of those things while you're also going after all of the usual suspects in the nutrient and hormonal deficiencies. So it can be a daunting task, but if you're being held step by step and you've got people like RA and I to help you along the way, it's totally manageable.
Awesome. I love it. So the last thing is I want to recommend to everyone here to take advantage of Dr. Hirsch's program, where he's going to guide you step by step and really walk you through a lot of the different strategies that he's talked about in this interview. So where can people go to get information on that? I know that you're just wrapping things up as far as that program is concerned and getting things done. But when that's out, which it will be for probably a lot of people who are watching this, several weeks or months from now, where can people go to find information on that and get that program so that you can walk them through all these different strategies?
Yeah, so go to fixyourfatigue.org and put your email address in there to download my free ebook and to get on my newsletter so that I can let you know when things are being launched. But we're in the process and we're moving things along, and I'm really excited about sharing with people, and it's going to come out in the next several months. And there's a book in process that I hope to launch in early 2017.
Awesome. Well, I'm looking forward to reading it myself and to sharing it with my audience. And thank you so much for coming on and sharing all this wonderful information with us.
Thank you, Ari. It was a lot of fun.
Yeah, thank you.